Hello, I'm Dr. Chris Cato with the Airrosti Rehab Centers, and today we're going to talk about plantar fasciitis. Now, a lot of people will associate plantar fasciitis as a running injury, and it's true, we do see a lot of runners who suffer from this condition, but it actually affects a wide range of individuals. For example, people who are either overweight or have recently gained weight, those individuals who started a new exercise regimen, and also people who have a high arch or a flat arch. And in fact, it's one of the most common conditions that we treat at Airrosti. And oftentimes, these individuals will seek out traditional care in the forms of traditional physical therapy, stretching, cortisone shots, and orthotics. Now, in the case of orthotics, and we actually will prescribe orthotics from time to time, orthotics need to be used when there's a structural or biomechanical issue that's going on with the foot. But today, what we're going to focus on is why Airrosti is so effective at treating the source and the cause of the pain and inflammation that's associated with plantar fasciitis. So now let's talk about the symptoms of plantar fasciitis. Most people describe this condition as a burning, painful, pulling, even an ache in the bottom of the foot, and a lot of times near the heel of the foot. And most people will notice this, it's more extreme when their first steps in the morning. So when they first get out of bed and they take that first step, they feel a lot of tension, a lot of pain, and a lot of pulling on the bottom of the foot. Also, individuals who are standing for a long time that suffer from this condition will also notice pain in the bottom of the foot as well. Now, what we have here is an anatomy of the foot and the ankle, and we're going to kind of get into some of the biomechanical issues that's going on with this condition. So here's a closer look at the plantar fascia. It's a thick band of fibrous connective tissue that attaches from the base of the calcaneus, or it's commonly known as the heel bone, and it blends all the way into the toes. The major role of the plantar fascia is to support the arch of the foot. And what can happen is if you increase loads, whether it be weight gain or increase in activity, like say running and things like that, you start putting pressure down through the arch of the foot, which causes a stretching of the plantar fascia. Over time, this creates micro traumas or tears, which will lead to the inflammation and pain that's associated with plantar fasciitis. Now, a lot of times, people complain of specifically heel pain, which would be right here at the attachment site of the plantar fascia and the calcaneus. So instead of it occurring along the length of the arch, in this case, the inflammation and pain is occurring here. So now let's talk about how the arch affects plantar fascia. Over here on the right, we have a normal foot with a normal arch. Over here on the left we have what's considered a flat foot or an individual who may pronate. Now, as you can see here is the main difference between the two is the dropping of the tarsal bones. That drop is going to put increased pressure or tension along the plantar fascia, and you may experience pain or symptoms along the arch of the foot or at the attachment of the calcaneus. So that's flat foot. When we talk about someone who overpronates, what I'm meaning is when they walk, they're doing this instead of doing this. And so you can typically have somebody who has a normal arch from the standing position, but when they walk, they start to overpronate. And that overpronation is just like this. It's forcing these structures and putting pressure down on the plantar fascia. Now let's talk about somebody who has a high arch. So imagine this arch being even more increased in this direction. So instead of something like this, an arch being like this, you have an arch that's like this. There's an increased distance between the calcaneus to the base of the toes, and that pressure is going to put more pressure along the plantar fascia versus someone who has a normal arch. All right, so now let's talk about the treatment portion of plantar fasciitis and why Airrosti is so successful at treating this condition. One of the first things that we're going to look at, not only as we talked about earlier, looking at the bottom of the foot, our providers are going to also evaluate the lower leg. And specifically, we're talking about the gastroc or the calf muscle, the soleus that's up underneath the gastroc, as well as the posterior tibialis, which is kind of on the inside of the shin. What's important to note is that all of these muscles, the connective tissue, the fascia that's around those muscles, are going to come down, blend into the Achilles tendon, which attaches to the calcaneus. You also have a continuation of that connective tissue that also blends in with the plantar fascia. Now, one of the things that you want to keep in mind is, let's say that her calf is tighter or more restricted. What that's going to do is that's going to cause an increase of the tension on the calcaneus, which is also going to put increased pressure or tension on the plantar fascia. So what our providers are going to do, once she has kind of gone through the full assessment, evaluating and assessing through palpation, orthopedic test, muscle test, find out where the restrictions are in the calf, in the lower leg, as well as in the plantar fascia, and manually they're going to go through there and correct those fascial distortions or fascial restrictions. It's kind of like ironing something out. We're going to straighten out that connective tissue, that whether they have adhesions or some scarring tissue along in the calf or around the Achilles tendon. And we're also going to do some manual work or myofascial work along the plantar fascia. Also specifically, we may even pay close attention to the heel, where that plantar fascia attaches to the calcaneus. Another important part of the treatment of plantar fasciitis is the role that the patient plays with the active care. As you can see here, we have the patient foam rolling her lower leg, specifically the gastroc, the soleus, and down to the Achilles. This is to help to relieve the tension causing her plantar fasciitis type pain. The patient will also be given other exercises to do at home, including working with a lacrosse ball or golf ball on the bottom of the foot, as well as some wall stretches to help alleviate some of the tightness that's occurring in the calf. Now, once the patient has finished their foam rolling and have been taught their at-home exercises, we're going to apply kinesio tape to the area. 1 for support and 2 to help reduce any inflammation. We're going to support the plantar fascia as well as the lower leg and the gastroc area. Thank you for watching our video. Hopefully you found it informative and educational. If you ever have problems with plantar fasciitis, please don't hesitate to call. Thank you and have a great day.